officially afternoon, good afternoon. I'm Reverend Sharon Butchery, resident of Hamtramck and currently the volunteer facilitator for the Detroit Hamtramck Coalition for Advancing Healthy Environments. And we have some of our team members here today. If they would stand, we have Jennifer, Rachel, Diane, and Sydney, you'll hear from later. And we got started in environmental justice work back in 2016 when our dear Rep. Rosemary Robinson informed us that there was going to be an expansion of a hazardous waste facility right over there. And so we got involved in trying to stop that expansion. We weren't successful, but we did get truck traffic rerouted, and we did get fracking waste stopped coming into our community. And when that permit was granted in 2020, we said, hey, are we going to keep going here? We have a lot of work we can do. We learned so much from that experience. So we changed our name from the Coalition to Oppose the Expansion of U.S. Ecology to our new name, and we made it we made public health our focus. When you do organizing around justice issues, you have to have people and money. And so we've been organizing, we've been blessed with some grants, and one of the things we decided was we didn't have enough data about this east side area, and we decided we would really like to do a health study, but in order to do that, we didn't want to study the community without getting feedback from people. Like, what is it that we should know? What do you know that we don't know? What do we all need to know that we don't know? And so this opportunity today is about hearing about the plan and then getting your feedback. So we're delighted today to have each of you here. I hope you'll get to know one another as well. And we're very delighted to have Senator Stephanie Chang with us. We are blessed to have her as our senator here after redistricting. And is your new office open yet?
Kind of.
Kind of. Okay, you can tell us about it. But I promised Senator Chang that she could have some moments to speak with us before we get started. Welcome.
Thank you. Well, hello, everyone. Super excited to be here and hear about the great work that's going to be done, that is ongoing. I'll tell you that the concept of health impact assessments and health needs assessments have been something that, you know, for so many years across the districts over the different times, you know, when I was in the House and then in my old district in the Senate and then now my new district, it's something that just keeps coming up, right, of the fact that we need health impact assessments for so many of the major projects that we're talking about. So when I actually used to represent Southwest Detroit, one of the things that I'm really proud of is that back in 2017 when we were able to secure community benefits agreements with, well, first initial community benefits around the Gordie Howe International Bridge. Health impact assessments was one of the major things that we were able to secure. But this is something that we should just continue to make sure that we're advocating for every major project. And then also, even when there isn't a major project that's about to be underway, to ensure that it's something that we're doing in communities that are overburdened by air pollution. So wanted to just say a few things about, you know, what we're working on in the legislature when it comes to air quality. So, you know, I have been working on a lot of environmental justice legislation over the past 8.5 years. One of the bills that is actually moving forward now, finally, very excited about it, is a bill that basically ensures that when companies who have violated the air quality standards or their permits, you know, right now, as you probably know, the fines that they pay in the consent agreements that are developed, the money goes into the state's general fund. That money doesn't necessarily actually come back to the impacted community. And so just over the past 8 years, I remember especially the first couple of years when I was in office, going to all of these hearings around the various consent agreements that were being proposed. A lot of residents were saying, well, why isn't the money actually coming back to us? You know, we're the ones facing the pollution. Why aren't we getting the benefit of the fines that these people are paying? which is a really good point, right? So we actually are working on a bill that it's actually out of the committee now and is moving through the process, which basically makes it so that the fines that folks pay when they violate the permits, violate the air quality standards, that a certain percentage, 30%, goes back to Eagle rather than disappearing into the general fund, so that it can be used for air quality enforcement and mitigation, training, compliance efforts, things like that. And then the 70%, so the bulk of the money would actually come back to communities that are impacted by these violating, the companies and their resulting air pollution in the form of health impact assessments or buffering, or really just honestly whatever the community wants. There will be an advisory council that's set up that will advise Eagle on where that money should go, and also sort of prioritizing environmental justice communities, defining what that looks like, and I'm really excited about it because honestly, it will be the first law that we pass in Michigan that even uses the words environmental justice, I believe, I'm pretty sure. And it is something that is just really long overdue. And so I know that this community is very much aware of companies who have violated the air quality standards over and over again. And also have seen the fact that the money has not come back to this community. So I'm hopeful that we can continue to move this bill forward. As I mentioned, it's out of the Senate committee now, and so on the full Senate floor, hoping we can keep that process moving. But also, working on a number of other issues as it relates to water affordability, other air quality issues. I know that, right now there's a number of sort of very localized issues when it comes to the demolition of the incinerator, ecology, lots of different things that we really need to continue to work on here in this area. I'm here to be a resource. Allison's here for my team. And so definitely feel free to stay in touch with us. We are definitely want to be engaged, especially when it comes to town halls like this, but also if there are things that you all are advocating for where we can be helpful. We love also going door to door, just helping with different efforts. So to make sure that folks are aware of what's going on, and also opportunities to engage, whether it's a Eagle hearing or a town hall or anything else. So just appreciate all the work that you all are doing. I'm really excited about this work. It's really groundbreaking, and hopefully it could be a model, for other communities as we move forward. So thanks again. And I don't know if you want to do questions or
Yes,
just jump
please.
into
Any questions for Senator Chang while she's here? This is her day in Hamtramck.
I just wanted to ask about water affordability has been a real issue here in Hamtramck and water shutoffs. I mean, we've actually gone around house to places that have been, which home has been shut off and tried to help the individuals. But how is the legislation going?
Yeah.
I know you've been working.
Yes. Well, so this is, we've worked on this for about 8 years now. We've introduced legislation in years prior, but we actually have made so much progress. So this year, for the past few months, we've been having meetings on a regular basis in a way that actually is really exciting. We've brought together water advocates, environmental advocates together with water providers and municipalities, people who just have not really been at the same table together to come up with solutions, figure out what we can get consensus on in terms of water affordability and shutoff. So we're meeting all the time, and I feel like we're getting closer and closer to something that that folks can actually agree on. And so basically where we're headed, where I think everyone is now has the shared goals of let's create something at the state level that ensures that folks don't have to pay more than a certain percentage of their household income on water, and create a fund that is, we're still working through the details, but a fund where, well, I won't get into the details, but we're still working on exactly the mechanism that will help make sure that this is something that is sustainable, and then also building out protections against water shutoffs for folks who are have health conditions or different things where they absolutely need access to water to live. And so we're making a lot of progress. I really feel like we've got way more momentum on this issue than we have in previous terms, in part because we've got providers themselves who actually want to see water affordability programs done, including DWC and CLEWA. They've got programs they recognize, and I think a lot of it's due to the pandemic, right? Because during the pandemic, we had federal money come down to help pay down people's water bills, and then because of that, we had data for the first time ever in the state of Michigan that showed, okay, well, this is how many households in like tiny village in the UP and like the suburban township over here and big city over here, just really across the whole state, that showed that we have people all across the state who have been behind on their water bills. This is not just a Detroit or Hamtramck problem, this is a statewide problem. And I think it was a huge wake-up call to a lot of legislators and providers that, actually, if we can, what's good for people is also good for the providers in terms of, like, let's make sure that people can actually afford to pay their bills. So lots of progress. We're excited about it and hope to be able to, the work group process is ongoing. We're getting closer and closer to be able to have something that folks agree on and that we can introduce and, get moving. So.
Other questions? What was that question that came up when we were just having some informal discussion yesterday about, I know that the state has mandated that the water pipes, the leaded water pipes be removed and replaced. And Mark was raising something about, like in his neighborhood where there's vacant houses. Can you explain that issue and, how can it be addressed?
Well, I was told that, you have a bunch of vacant houses on the block, and then how they shut off those waters, and it's not enough people using enough water, and the water is sitting. That's had the lead, make it lead, and the people that do have water have lead in their water. Like, how can we figure out a way to fix that?
You're saying when there's just a regular water shut off, or when you're saying
when
they're shutting off to fix the.
So we like on one block, there's only 3 people that live in houses.
I see.
And so but they're saying that the water sits because it's not being used and moving, that it touches lead service lines.
Yeah.
Stagnant water, I guess, because it's not being used enough.
Okay, let's follow up on that, because I'm not sure about policy. Let's talk about it, figure out what we can do.
But just because I was also in that conversation, it's kind of like whether it is, the houses have been leveled, so there's no water going, in or out. But it is also with the shut-offs. It's like the less, the less concentration of, of households, the less the water is flowing through these pipes that are meant for much larger populations. So the effect is kind of the same.
Yeah. And of course, the goal though is let's replace all the lead lines, then we won't have this problem.
Yeah.
And I know that at the state level, we do have money that is available that various cities have been applying for, although it's not nearly enough. And I think everyone recognizes that we're trying to use the money that we do have, and hopefully we can keep getting the federal government to give us more. Yes, it's a huge problem. We're behind, but I think that there is very much an awareness that we need to fix this. So, but it all costs a lot of money. So, but yeah, let's keep talking though about this issue when there's a shut off due to a demo. Wondering if we can try to figure out some localized solutions on that. It's a great idea.
Great. Anybody else?
Thank you so much, Senator
Thank you. We appreciate your time. Senator King is definitely one of our champions in Lansing, and her staff is here, and so please contact her when you have a concern at the legislative level, at the state level.
Oh, and the office. Okay, so we do have an office that we have moved into, and I'm not sure if there's a sign yet. Is there a sign yet?
No.
Okay, we have an office that's on Joseph Compo that will be opening. We're probably going to do an open house later in June.
Oh, fun.
So we're very excited because we've been waiting to have a new office for a very long time. That's because our current office well, I guess the week's ended. So our old office was at the Samaritan Center on Connor, which was wonderful, but now it's literally on the border of our district. So we wanted to have something that's a little bit more central. And Hamtramck, we thought was the perfect place.
And
So
we're thrilled. So,
yeah.
yeah, being
Wonderful.
that's great news. So I just wanted to make sure that everyone has an idea in your mind of what environmental justice means. You can care a great deal about the environment, but environmental justice means that there are certain populations and places where there's an overburdening of pollution and toxins that is based on race, poverty, other demographics, socioeconomic demographics. And so when my neighbor takes her child to the hospital because that child is suffering an asthma attack, it's much more likely that other children like that child who may be black, brown, immigrant, who may be living in an area like Hamtramck where the poverty rate is high, that there are many, many more children like that than there might be in another community. Not to say that these problems aren't statewide, because we definitely have communities around Michigan where there are places where there's aggregate mining, lead issues. There are a lot of issues in Michigan. But particularly in our area, and we're focusing on these 3 zip codes or census blocks on this near east side, that's one of the things you can weigh in on today, is what should the scope of the 2024 study be? Where should we concentrate it? For the purpose of our feedback, we've been just looking at 3 zip codes, 48211, 212, 213, but you may very well have wisdom about other communities right here on the Near East Side that we need to focus on that are really overburdened. So when my doctor tells me after my knee surgery to take 2 Tylenol every 4 hours, my doctor is going to know that I'm also on an opioid that they gave me in the surgery for a few weeks, and that I also am taking Mobic, which is another anti-inflammatory. Your doctor knows not to put too much stuff in your system, right? But the state of Michigan does not do that. They allow each industry to emit into the air and into the water certain levels of toxins that are safe for us, but they never look at the whole, how it all comes together, and then we're the ones who have asthma, cancer, preterm births, low birth weight babies. All these things that we're going to be looking at in this study. So I just want to prime the pump for Sydney, because she's going to tell you about the study that we created based on what we learned through our process of working on environmental justice. And then we definitely need to hear from you. What have we missed? What is out here that you know about because of your families, your personal health, the health of people in your community that we need to be looking at, all right? Any questions before we get started on the presentation? And then maybe lots of questions after. This is Sydney Warner. She's with JFM Consulting. She's our person who's been helping us create amazing materials, and so we can get our stuff out for the door-to-doors that Rachel and Jennifer and I and Diane have been knocking on doors all through these zip codes. And so, Sydney, thank you.
Thanks everybody, thanks for the kind welcome. As was just mentioned, this is kind of the planning phase for these really big projects that we're looking to instill in the area to really help advocate for not only our individual health, but our collective health as well. So kind of what this presentation will consist of are these plans. There's 2 pieces, a cumulative health impact assessment, which Reverend Sharon was just referencing how all these different industries can all come together to really cause harm, things like asthma, cancer, etc. And there's this second piece, which will be the health needs assessment. So in both of these, and I'll explain in detail what these are a little bit more further so you have a better understanding of what this will potentially look like. But both of these pieces right now are in the planning phase, and as mentioned earlier, we can't really plan anything for the community without the community. So we're really just looking to get into what maybe we have missed in these plans, other things you would like to see, things of that nature. So we kind of already went over a little bit of who the coalition is, who we are, what we stand for, but largely residents of people on the east side in Hamtramck, really just looking to advocate for our own health. Some of the visions and missions of the coalition are to have healthy and clean air, water in Detroit and Hamtramck, as well as defending our neighborhoods for the advancement of our healthy air, water, soil, etc. So what you have in front of you, the little infographics, first we'll go over the Cumulative Health Impact Analysis Plan, or CHIA for short. We do also in the back table have these documents translated in both Bengali and Arabic. So if you would like those resources for yourself, for neighbors, there are more on the back table there. So you can look at these on the screen up close. Some of us work on screens all the time, so it's nice to kind of refresh our eyes and look at an actual piece of paper. So I'll go over each of these sections of the document in more detail. Again, this is the planning phase, so each section has the opportunity for revision, for change, for anything else you would like to see included. So one of the main reasons why that we're looking to conduct a CHIA is because collecting information like this will really help support policy change and kind of provide that data that will back things that many residents of this area already know. So providing a little bit of proof there. And then also we'll be able to, just one second, I'll finish the slide and then I'll leave a second for questions. Another reason for the why behind this is not only to collect information that scientists or public health professionals can understand, but to make sure that the people who are most susceptible to things like air pollution, water pollution, are also able to digest and understand what's happening. So really able to provide that information back to the community. Yes, your question.
I'm sorry, I came late, and I apologize. So are you looking to collect data from residents, or are you looking to, what is it that the CHIA represents? Is it an education in the community? Is it something to collect data to advocate with local companies and through economic development or whatever?
Yeah, so that's a good question, and the answer to that is both. So the CHIA more specifically will focus on data that can be collected in the environment itself using some census data. The next, I think, 2-ish slides will show exactly what data points we're looking at. But the health needs assessment will be going out to the community, and that's where we'll get feedback from people. And again, I'll explain that for the detail as well. So both pieces. Any other questions before I move on?
I would like to say there may be some data points where we don't have that information out in census data or others.
Mm-hmm.
So we will be looking for funding to possibly do in-person research for data points that we can't find in the public spheres of information.
So to describe a little further what a CHIA is first will end up being this big fancy report that identifies different pollutants, stressors in the environment from all these multiple different sources. So not just one company, not just one industry, but looking at the really big picture, because that big picture affects us at an individual level. What it also helps to do is identify problems and ways to improve those problems, as well as community health. And then what's kind of the underlying theme of all of this is this idea of advocacy, communicating these results back to the state, to senators, to people who have the power to kind of make these changes. So there's kind of 5 main categories that go into a CHIA, and that's decided by the EPA. They sort of set out this framework for communities, coalitions like us to figure out and document these different sources. So the first is socioeconomic factors. So things like how many minorities live in a community, how many people are under the age of 5. And again, I'll go into detail on what each of these are in the next couple of slides. The second indicator is sensitive population, so people that may be more likely to have asthma or more likely to suffer from some of these different pollutants. The third category is environmental exposure, so what's causing the pollutants to be in the air. The fourth category is environmental effects, so things that happen from these exposures, as well as public health effects, so things that people will experience due to these exposures as well. And like I said, I'll get into each of these more specifically. And they're also on the documents in front of you. After each category is gone over, I'll pause, and if there's anything else you would like to see specifically, you can shout it out. We'll take some quick notes. Also, as a little heads up, we do have a survey at the end of this presentation, and if you are a paper person, there are also paper versions of the survey on the table behind you all as well. And you can write down those additions and feedback as well. So the first is socioeconomic factors. So currently we're planning to look at these following identifiers. So the first is unemployment levels. And again, for right now, we're really planning in 48211, 48212, and 48213. And again, that's sort of open to suggestions because if there are people that you know that are more affected that maybe exist right outside of those zip codes, we want to make sure that they are included as well. We're also going to be looking at income levels and how many residents are under the federal poverty levels. We're going to be looking at race, so this is breaking down all the different racial identities. Household size. Access to health insurance. How close houses and individuals live to these different and various industries. Similarly to that is living as close or in close proximity to the highway. So I'll pause here. Is there anything initially that comes to someone's mind that they're thinking, I would like to see this socioeconomic factor included? And if it's a little bit on the spot, that's okay, we can revisit it too. Yes?
What about identifying the actual industry that's in those areas?
That wouldn't necessarily be under socioeconomic factors, so we'll come back to that in a different slide. But yes, very good point. Education levels?
Level of education.
Okay.
Household members.
Okay, that's great. Yes.
I'm from 48213, so I like to hear this.
Mm-hmm.
But thinking of that same zip code, like you may not have that same factor of people because they may be renting or homeowners. So what's the chance of that person still being in part of your study in the next year, 6 months if they're not a homeowner?
Right, that's a good point. Another thing that we'll look at, which is technically under a different category, is how long you've lived in your household. Because if you've lived here longer or are here short term, your exposure levels are different. So we do sort of tackle that, but not necessarily in this way. All right. Great. Sorry. So the next indicator is sensitive population. So we're looking to, again, try to sort of assess the number of people who are under the age of 5 because they're more susceptible to pollutants as well. Similarly, adults over the age of 65 for that exact same reason. Immigrants and people who are not born inside the United States. People who are pregnant. How many preterm birth babies there are. Oops, and that was the last one for that. Any other sensitive populations that maybe immediately come to mind? Yes.
What about like immunocompromised folks? Would that be in that same category?
Yes, they would definitely be a sensitive population, so we can make sure that's included as well.
Would
Yes.
that include people with all types of chronic health issues?
So it could. Basically, again, sort of the point of this meeting is to get whatever else information we may have missed. What we do also look at, and I'll touch on this again, is we'll look at those rates of different diseases, so lung cancer, hypertension, diabetes, etc. So that sort of captures it, but yes, they are a sensitive population.
Those with disabilities?
Okay. So, others? All right.
I'm gonna raise my hand one more time.
Yes, of course.
What about veteran status, or is that in a different population category?
No, I think that's definitely and could be a sensitive population. To his point over here, oftentimes some veterans are maybe disabled or are immunocompromised, so they also would qualify for those same reasons. But it's definitely a category that we can put in on its own. All right.
I see this, sorry.
Yes.
Just jumped out. And I know you've got foreign-born residents, but I know that in sometimes we consider just limited English proficient. So
Yes.
it may, obviously that overlaps with foreign-born residents, but
Yes.
it might also be like, yeah, might
Yes.
include other people or might be smaller, so.
Yes, the main sort of caveat behind that is it's hard to capture that language data. So the way that we sort of try to tackle that is based on resident status. All right, great. We'll move right along. So the next category is these exposure to harmful substances. So this is where we get down into the nitty-gritty of what is currently in the air, the water, the soil. Whether we're breathing it in, drinking it in, absorbing it through our skin, etc. So one thing that we want to look at is particulate matter, both PM 2.5 and PM 10. The main difference is just the size of those particles. The smaller the particle, the easier it can get into the lungs, deposit there, and cause harmful things. Just as a little reference, particulate matter can come from diesel exhaust, it can come from smoke, other emissions, things of that nature. We'll also look at volatile organic compounds, one of the two, which are usually known to cause cancer. They can exist in furniture, in non-sticky pans, things of that nature, and are also emitted. We'll look at CO, ozone, lead levels, PFAS and PFOA, which are also commonly found in emissions from industry, as well as those sort of non-stick pans, plastics, etc. We'll look at both NOx and SOx, so nitrogen oxides and sulfur oxide. So often if you have ever smelled that rotten egg scent, that tends to come from these. And then other carcinogens / fancy word for things that cause cancer. Is there anything else that's maybe not on this screen that you would like to see specifically included that you know or have an idea of that exists in the environment?
So when you say like something like lead, it can come through multiple channels, right?
Yes.
And so it can be like soil, things that are grown in the soil that we can ingest. It could be from paint, through some water and such. So are you going to be able, when you do this kind of research, are you going to be able to then go back to what the sources are?
Yes, so there's a couple of data sources that already exist that we'll pull from to capture some of this. MDHHS has some blood levels in this area already identified. There are also studies that already exist from Eagle about the levels that may be in the water or in the soil. So depending on what data is available, and to Reverend Sharon's point earlier, if we feel that maybe there's not enough or it's not showing the big picture, that additional funding may go to testing the soil or doing lead level tests. Both of those things are very expensive and very time consuming. So we want to make sure that we can access all the available data that exists first and then kind of fill in those gaps as I mentioned. Others? Yes, go ahead.
So asbestos, sometimes I wonder about house siding.
That is definitely a good one to add. Others?
about the symptoms of the substances? Would you,
That's coming right up.
okay.
Not this slide, but the next one. So the fourth factor is surrounding environment. So who/what is contributing to these different pollutants being in the air? So of course, we know industry is one of the leading entities, and that is also doubled because there are so many within this region. So that's sort of where we'll get into your point earlier, how many industries are in the area, what are they typically known for polluting, what else are they emitting, etc. Included within that, there's also hazardous waste sites in the area, so we'll be looking at those. Again, what sort of waste are they removing? Are there side effects of that, etc. Same thing for water treatment plants, both drinking water and wastewater. How many of either the sites or the industries or other areas are contaminated? We'll also be looking at the number of semi-trucks that go both down the section of 75 that's near here, Joseph Campo, other main areas. In addition to semi-trucks, little caveat, there's heavy-duty vehicles as well, so may have the same amount of pollutions, but isn't necessarily a semi or a delivery truck. And then what we'll also be looking at is the amount of tree canopy, and this sort of is a positive, but we want to make sure that there is an ample amount to sort of counteract or work against some of these other things that are contributing to the environment. And same thing for parks. Are there areas for people to play? Is there grass? Is there trees that help sort of refresh and filter the air? That is the last one for this slide. Is there anything else in the surrounding environment that you would all like us to look at? Yes.
There's a question of what's the policy of the city of Detroit or Hamtramck when removing dangerous buildings? Like the incinerator? Is it going to be totally removed?
It's going down now.
It's
Well, the
going
stack
down,
is going down early Sunday morning.
and it creates enormous amounts of pollution in the community. How do they do that? Are they putting water on it? Are they informing the community? How are they protecting the community?
It's definitely a good question. I unfortunately don't know the answer to it. That is kind of up to their discretion. But I think that there's probably a workaround in which we can make sure that's included, if not necessarily tested or studied, putting a disclaimer that not only do these industries exist, but there's also a lot of demolition, and that also is a contributor as well.
Wouldn't it be the
Yes.
State Department of Health that's in there monitoring, looking for levels in the air and such as things come down? I mean, that's when you hear the reports.
Ideally.
From them.
Ideally, but
Yeah, BCED is on it for the city of Detroit. The engineering folks have brought in specialists. Sydney, I thought of another one for harmful substances, especially with all the road construction that's going on. You see a lot of dust. You don't even see the workers themselves protecting themselves from all the silica dust. And that's one of the most harmful substances for our lungs is dust-related concrete, silica. There are some regulations about it, but I don't think they're very well enforced.
great, yes.
I was thinking for surrounding environment, maybe light pollution or noise pollution.
Also heat maps.
Great. Yes.
What about I don't know how you capture the built environment? A place like Hamtramck where we live, all these things kind of pack on each other, and we're trying to survive.
Yeah, one way we sort of try to capture that is looking at the tree canopy and park to house ratio. But we can definitely explore more ways to look into that.
Yeah, I mean, if you took an average, if you looked at the houses, they're mostly aluminum clad right here, but underneath that, most chances are it's lead paint. And so I'm sure there's been some studies on how much of that is actually becoming a part of the aerosol. Right? You see? Oh,
You didn't raise your hand?
I was just
Oh.
for a different point.
Oh, go for it.
Oh, I was just, it is interesting how you sort of distinguish, some of the more, hazardous points to, like the tree canopy in parks, but even within the parks, in Detroit, and a lot of, people's yards is pesticide use. So it's like even though we live in such a toxic environment, people are willing, for the sake of like some green grass lawn, to poison their own home. So on top of like an already burdened, community.
That'd be a great question to ask in this survey.
And it's like, it's not
so
even
many
like
people are still using them.
people's homes, but like in the outdoor spaces, like the parks that you have on there, like even our city parks get sprayed with poison.
Yeah.
So it's like,
I was told that you're not using pesticides.
but they do. I mean, the little signs are there, so they're not gonna put up those signs if they didn't just spray them, so. The DeQuinder cut is, one example. Like I actually live, right, but I do live, I actually live in the city of Detroit, but very close to Hamtramck, and all of those parks, all of the surrounding outdoor spaces, all of the museums, the hospitals, the colleges, all of these, sort of institutions, city of Detroit, spaces themselves, they all spray.
And that also touches on an unfortunate reality is that people lie. So the data may not exist for the things that we know are occurring. So that is a problem with all of this big picture stuff, but as I mentioned before, it's definitely something we can explore, we can look at, we can see what exists to, maybe if we find that they reported that there was no spraying, but on a random Tuesday, there's a sign there that can be snapshotted in a picture, and that can be included in the report to say, you say this isn't happening, but here's documented proof, things like that. Yes?
So maybe a part of the built environment there might be data on is if they've started to really look at those exposed areas that are the heat, I don't know exactly what they're called in the public environment, but where it's just way too much sun is getting through. And large sections of streetways, parks, where there's absolutely no shelter, creates this heat sink effect that really gets multiplied on in our intensifying weather.
Yeah, definitely.
Because I think there are municipalities that actually have people that are dedicated to work on those. Who actually are there to reduce the number. Certainly it's happening all over Europe. I know New York has it. So.
Historically, we are very far behind Europe when it comes to environmental justice. Anything else before we move on to the health effects? Yes.
I'm wondering regarding parks and trees specifically. I know a lot of parks departments around the U.S. purposefully plant only male trees because they're not fruit bearing. But as a result, the air quality, I don't think this is super well researched, but yeah, I think air quality as a result, because of all the pollen, it's affected. So I'm wondering like if our parks department has that kind of policy.
It's definitely something we can explore.
Okay, yeah.
Yeah. Yes.
Thank you.
I'm curious, especially like, in more low-income areas, with like building materials, that are old, like the asbestos siding on a lot of houses that are, really too expensive to, take out and replace. They just continue to sort of like decay, and I can't help but wonder if, something like, building materials, or like, with some of like the really like the prefab, kind of like really sort of cheap materials that a lot of the newer places are built with. I wonder if like inside of a home in that, environment, or, sort of like rotting or decaying, things like asbestos siding to the outside environment, if something like those would be included in that?
I think we could definitely look at an analysis of the age of the homes and then sort of make some estimations based off that. I myself live in a 97-year-old home and have the asbestos wrapped in my vents, so that's a very good point. I think also we can include, there's ways that the city has tried to mitigate, lead paint, repainting over, houses before a certain year. But I think that looking at the age of the house is something that could very easily be, or the average age of houses in the area could definitely be included and looked at. Yes?
I know recently I was involved in initiating through complaining the cleanup of the corners of I-75 and Kniff, where it was perpetually being filled up with garbage that people threw from their cars, mostly. But also, I was told by a gentleman named Reginald Washington at Wayne County MDOT that this area of Hamtramck was, when it was made, when I-75 was developed back in the 60s, that it was designed to have all these trees and bushes where they're at Kniff and I-75 to twofold, not only for beautification, but mainly to keep, whenever we have big rainfalls and so forth, to keep mud and sludge go down into the freeway when we had these big rains. But as a result, it collects all the trash that blows through from downtown Detroit. And I said, well, I want to go out there and clean it up. And he said, you can't because you're interfering with UNIT. There's contracts for that. And then he later on, through another corner of his mouth, said that there never was a contract to clean up the area between the boulevard and the Davison, which is us, basically. So we collect all this trash. So I went out there and cleaned the best I could on the outside, but I felt I had no rights to go on the inside of the fence, and I was afraid anyway. But from the efforts of this gal named Kathleen Thomas, wherever she lives and works here in Hamtramck, and the city, I guess, and I don't know how much the county got involved, they ended up doing a beautiful job on the inside of that fence line. You can actually, see the freeway now. And then I got on the phone with this Max Gavarino, my son isn't named and continued to complain about the entrance ramps, which were equally filthy. We used to have those barrels. For months we had barrels, but no construction. And MDOT came after I complained and took those away, but left all the trash. Bags filled with stones that they used for their road closure signs and so forth. So it's finally clean. But it makes me wonder whenever I went there and cleaned up what I could myself, what was I cleaning? What was all over it?
Yeah.
Where did it come from? And so we're still trying to keep it clean, but whatever happened to the contract? Why is it, and there is an answer to this, that Hamtramck always gets treated like crap while downtown Detroit is being beautified? We're one of the communities people see first sometimes when they come down here, come to eat here, okay? And the reason for it is, there's money that comes for Hamtramck, but do you know what the state does with it? They allocate our funds to the city of Detroit downtown because things are going on there and things aren't going on here. They want that money to make Detroit look better for visitation. And it makes sense, but in the meantime, we've got what we've got.
And that's one part of the motivation for why we're even trying to get these plans together, why we're looking to, host events like this to get those concerns and bring them to light, whether it's just me listening or other people listening in general. So I'm very glad that you raised that point. All right, I'll move on to the next part, which is, forgot one. Also want to look at how many health clinics, hospitals, local doctors' offices are available in the area. Yes, that's the last point for that one. And then this is the next section that was mentioned earlier, the actual health effects of these exposures. So we are going to be looking at the average life expectancy, obesity levels, diabetes levels, levels of hypertension, heart disease, various cancers, asthma, in both adults and children, and then children hospitalized by asthma or asthma attacks, the number of strokes, the lung cancer death rate, the heart disease, and the heart disease death rate. So, anything else you'd like to see? Yes?
I don't know if I want to see it, but
Fair
I
enough.
shared with Sharon when I first met her that years ago, back in the 90s, when I couldn't conceive, I couldn't conceive because of endometriosis, which I didn't even know I had until I was in my 30s because they can't diagnose it
Right,
by any, x-rays or normal ways.
right. Only a laparoscopic procedure.
We had that waste treatment, medical waste treatment plant going that they eventually shut down. Okay, and I wasn't aware of it at that time, but I was in touch with the Endometriosis Association of America, and I wrote them a letter, and they said, did you know that you're living within a short distance of one of the worst medical waste treatment plants in North America, one of 5, and it's producing dioxins, and that might be contributing to the growth of your endometriosis. Well, that was in the 90s, and then all these years later, they came up with Facebook, right? So I got in touch with all my friends, 2012, and I come to find how many of my girlfriends that I went to Hamtramck High with lived here, can't have kids. And I asked at that time in the 90s, because we didn't have answers for that, other than I was told to hope for an early menopause. Because it was painful. There was so many people, so many women like myself experiencing the same kind of symptoms. And the doctors telling them they couldn't do anything for them. To maybe if you have $25,000, you might be able to find a way to conceive. Well, I think they can do better now.
Right.
So I'm not sure if that's still an issue, but it was something, and I became their poster child for 1 year for their fundraising all over the world. But what can happen to you?
Right.
And I'm still up for cancer from it now. So.
I think there might be a way to look at infertility rates. The hard part of that is a lot of people don't know and don't know the source, or it's not documented because people don't go to the doctor. So I'm guessing there's a way to look at that, but that's something we will definitely be looking into. Yes.
Yeah, and I don't know if this would go into this category or a different one, but the woman who just spoke reminded me of like some of the sort of most common chemicals are like endocrine disruptors, which are affecting people's hormones. So I mean, I guess that would be the effect, but then there could also be, some of the, it could also be as part of maybe the exposure to harmful substances, like those substances create these effects.
Yes, and a lot of those substances that were listed are also endocrine disruptors. So there are some others that exist that we could explore and look at too. Yes.
So along with infertility, like you said, preterm birth rates
Yes.
and things like that. So I didn't see that on that list, so.
That more, I mean, it could be included here, but the way that we sort of looked at it based on the data that's available is because we can't really capture preterm birth before the baby's born, so that preterm baby is a sensitive population. But technically it would apply here too, so either way it'll be included. It just may not be, in one category versus another, but that's a good point.
What about birth complications?
We can look at those. Any in particular that you're maybe?
No, that was kind of a back question I had a moment ago is, so can you look at the data by these zip codes and then see what is it that's coming forward, as opposed to us trying to guess them? So that-
Yes, so MDHHS has a lot of that data already available.
Yeah.
And we'll be partnering with Data Driven Detroit, which has
Okay.
a plethora of resources to not only look at health effects, but they are like masters of the census data as well.
Yeah.
Yes.
For public health effects, do you think maybe like mental health could be
Oh.
something?
Absolutely. Others. And it's so funny because we think of these things all the time, but yet that's not on the board, right? So it's great that these are included, yes.
What about like kidney disease? Because you see, like, I mean, when I was growing up, I never saw, what are they called? Those clinics that flush out dialysis clinics. Like, I never saw those, and they're everywhere now. I don't know if that is, you know, what causes.
That's why, later stages of diabetes.
Well, it's also kidney. It's
Well, it's
flushing
kidney.
out the kidneys.
That's what you have to do. Unfortunately, that's the main thing.
If you've been lead poisoned too, it can suffer.
Others? Yes.
The liver issues? Liver.
Would addiction, I mean, it should be under mental health, but we don't classify it that way, so.
Anything else? Great. Well, that sort of wraps up the cumulative health impact analysis plan, those 5 different categories with plenty additional suggestions that you also thoughtfully provided, so thank you for that. Like I mentioned at the end, there's a survey. I took notes, but we would love if you could document those as well to make sure, you know, I have the context and we understand that the importance of it as well. So the second document, and this sort of will be where the community is a little bit more involved in the information collecting process. And this is the health needs assessment. So this is the plans for that. There's a couple of steps that will go into a health needs assessment, which we'll get into now. So describe it in a little bit more depth. A health needs assessment is basically a way to prioritize health issues in the community identified by the community. Instead of just assuming, you know, oh, you might be concerned about health, access to healthcare or whatever. We really want to make sure that the needs are being highlighted by those in need. Similarly, identify needed resources to tackle the different health issues in the community. And then next we'll go over the steps. So the first step is the planning phase. Part of that includes now, but really kind of getting into a little bit more depth. And just like the last one, I'll explain these steps further in the following slides. So the second step is to actually develop the survey. So a health needs assessment will be a somewhat lengthy survey, lengthier than the feedback form you'll have today, that will go out in various ways. And then once that is distributed and then collected back, the data will be analyzed to identify those priorities. And then again, just like with the CHIA report, we'll make sure that it gets compiled very nicely in a way to advocate for people's health. So as I mentioned, the planning phase will consist of a couple of things. So we really want to make sure that, one, as many people who want to be involved can be. So that can include a steering committee as well as additional advisors who may be impacted residents, public health students or public health professionals like myself, environmental justice professionals, health advocates, etc. It's basically anyone who wants to say can do so. And once the steering committee and other committees are formed, that will kind of drive the development of the actual survey itself. So this will, again, sort of help to identify who is most vulnerable, find out what resources are necessary, and prioritize those top health needs. So, like I mentioned, and this example list is very minimal just for time because it will capture a lot of those things that we mentioned previously that we sort of know are concerns, but want to, one, make sure that they're actual concerns, and then help to identify those things that we may have missed. So an example question is, maybe how long have you lived in your zip code? To your point earlier, people who may be renting or may be here for school, for example, or college may be here for a shorter period of time, but that doesn't necessarily mean that they aren't impacted. So we'll look to capture that. We'll also look to ask questions like, do you have any concerns about your health? So rather than asking you, do you have asthma, leaving it much more open-ended so people can identify what they feel is most important. Again, instead of us just saying, oh, well, we think that this is an issue, do you agree? Rather, tell us what you think the issues are. And then finally, another example question is, have you and your healthcare professional, doctor, nurse, have you ever discussed how your symptoms might actually be related to pollution, related to the environment? Because often the medical world and the public health world exist very separately, unfortunately, and they don't always overlap, so we're looking to sort of bridge that gap as well. Next, we will distribute this survey. So, just like the documents you have today are translated in multiple languages, we are looking to do that for the survey as well. Given that Hamtramck as well as Detroit and the surrounding areas do have a high non-English speaking population, we want to make sure that the materials and surveys are accessible to those individuals as well.
So there's, 13 languages spoken in the schools? And you talked about 2.
Yes.
And so on my block alone, I know at least 7 houses that don't speak English, Arabic, or Bengali.
Mm-hmm. So that is a very good point. Because we're in the planning phase now, the next phase will look, when these are actually rolled out, will look different. Hopefully additional funding will exist so we can have native speakers translate 2 more languages. Part of the sort of issue with that is getting those native speakers and not relying on technology like Google Translate to translate the information, because oftentimes those are missing cultural context. Maybe language has changed. The way that we all speak in this room is not like Webster dictionary language. So we want to make sure that that's reflected in our translations as well. That's a very good point. We are looking to have additional languages available.
It would be good to hire some community residents, and you've got plenty of college grads who are children and their families.
Mm-hmm.
And if you set it up right, you could get some very good translations and some buy-in by the community.
Yeah, absolutely.
What are some of the languages that
Bosnian, Albanian, Italian, Russian, Polish. Well, we've got a couple of Ukrainian families. I'm not sure that they're staying. And I believe there are some others that I just don't know who they are. Do you know, George?
All right. In that, we're looking to have this survey distributed as much as possible in as many modalities as possible. Just like the feedback survey we have today, we're looking at this larger health needs assessment survey will be available online, mailed to people who maybe prefer a paper copy, and then distributed door to door as well. We'll also have flyers that'll go out that have QR codes for people who do prefer / want to take the online version. And again, we'll have it available at physical locations in the community, doctor's offices, schools, grocery stores, coffee shops, etc. And again, once that is rolled out and then collected back, we will do some analysis to identify those top needs, concerns, and then recommend practical, realistic, and affordable solutions, not only at an individual level, because it's not always as easy as installing a HEPA filter in your home, to larger community level remediation solutions that can hopefully mitigate and minimize these negative health outcomes. And then again, once that is sort of all wrapped up and finished, well, I guess the work never is really finished, but concluded for the time being is this next advocacy piece. Just like the other report, this will be distributed to EGLE, to politicians, to people who not only care but have the power to kind of, back us and make that additional change. So that is the health needs assessment. So I will kind of pause there before I move on to see if you have any questions on either of those that may still be lingering in your minds.
Not those, but the school district just published an article about there's like 11 students that are officially at the high school that are officially bilingual. They received some sort of official recognition from that. So really that would be a good thing to think about working with is the students in the school. And there are teachers that know, and if so, if you needed help with that, we could help you with that.
Great, thanks for the resource.
Okay.
All right. So if you're looking for additional ways to get involved in the planning phase, you can take the feedback survey, which again, there'll be a QR code in a second or paper copies in the back. You can encourage others to look at the documents in front of you. You can take extras, you can hand them out. You can post them online on Facebook, like we just mentioned, is a really useful resource. And then also encourage those other people to take the feedback survey as well. So again, sort of kind of just how we did aloud today, the feedback survey will have it broken down per section to include those different recommendations, like adding to the sensitive populations, veterans, or those who are immunocompromised or disabled, etc. And then lastly, you can volunteer. So we do need some extra hands always to help with the door-to-doors, to help get the word out, maybe talk to some teachers at the high school, things of that nature. So you can talk to myself, to Reverend Sharon, to Jennifer, to whoever. Other than that, I'll give the opportunity for questions one more time. Yes?
Is this solely government funded?
No. Yeah, go for it.
So we were invited to consider funding with Kresge through it's a program called the KID. It's like an innovation grant. And we were, actually one of our public health students from Wayne State found the grant and helped me write it, and we received funds to be able to do this work. And then we realized we didn't apply for enough money for all the translation work. So we were also funded by the Ecology Center.
Oh, in Ann Arbor?
Yeah, by the Michigan Alliance for Justice and Climate and a national group called Communities for Health and Environmental Justice. So we put together a funding package. No government funding. So it's all been through foundations and other grant sources. So yeah, we always need volunteers to help with grants too. So we are a very active coalition. I do have an email listserv. Later today, I will be putting out the safety information about the incinerator stack coming down Sunday morning. We only get, you'll only get like 2 or 3 emails a month of upcoming meetings and actions. We have a very robust website. We have the toxic release inventories on there. We have every violation from U.S. Ecology South and what they did to address those odor violations. We have information about how to report smells and odors. Our website is a Weebly website. It's just DetroitHamtramck Coalition.weebly.com. That information is on our flyers in the back, and you can go there and find a lot of information that we have collected over the last 7 years doing this work. We would love to see you and to see you more often. And our snacks today are provided by Sea Love Baking Academy right here in Hamtramck. Please take some home. I actually have foil, so you can take a plate home covered with some foil to keep the smoke and dust off your food. And then whatever isn't used today will go to my granddaughter's kindergarten celebration, which is in an hour. So we would really love for you to take home some snacks. They're delicious, and if you ever need food for an event, Sea Love is ready to serve you. It's a woman-owned business helping women start, immigrant women start baking and dessert businesses here.
One thing I was interested is we can't rely on doctors for answers.
Yeah.
And I have rehabilitated myself from critical suffering. I don't know how to say it, from my early 20s. I'm 40 now, it's been 20 years. I'm part of the collective across the street. And we're trained in treating endocrine systems. We're trained in treating respiratory systems, preventative care. I have a student here who can speak for this care. And I want to see somehow that we can be involved as a way to care. We're also community gift run. We're nonprofit, like we're not for profit. So I want to see somehow that I can contribute in a way that it may feel something that's not here.
Awesome.
Like the HEPA filter. There's ways to make from HVAC filters a filter system that can be actually quite affordable and then very easy and very, very effective. I have 2 of them running through my house all the time.
We know that in environmental justice communities, indoor air quality can be worse than outdoor air quality.
100% sure.
That's one thing we need to include in our study is how we can improve indoor air quality. And there are some people doing that research. We may not be able to find public data about it. But I do also want to, for you to know that our coalition was involved in a civil rights complaint against the state of Michigan for the U.S. Ecology North hazardous waste expansion. And one of the things that we are asking for is that the state do this work. One reason we decided to do this was in a way to shame the state for not doing it. They should be protecting our health.
Yeah.
But we also wanted to show that there's probably a more robust and diverse bunch of indicators that we want to see that would not be included in an EPA study. And I am bound and determined to get the money to do that work. So we want to, even if the state did agree, which we hope they will, and we think they will, agree to do a study, we want to see a more robust study. Yeah.
So you're focused on the research and making the case and then legislative impact. What George is talking about is something about solutions for the community.
Yes, preventive.
And so is that under your purview or would that need to be somewhere else?
I think it'd be awesome to make that part of the coalition. Our coalition made it through COVID only because we did mutual care and mutual aid. And so I think that is a very big part of what we're talking about, is how to develop those resources in the community.
Yeah, because I think Anita, my wife Anita, would be glad to be a part of that as well. Matter of fact, right before you had this meeting, she
I
took a
saw
class.
her. So today's presentation was recorded on our cable channel resources, and so you'll be able to see that on channel 19, the Hamtramck Public Library channel. And thank you so much for coming. Introduce yourself to each other and to us. Put your name on our mailing list, and hopefully we'll see you again soon. We're going to have another focus group opportunity at Booksui, I hope, before the end of July. And so if you want to invite your neighbors, your friends, we'll have another opportunity that will be made available and publicized through our email list. Thank you to Sydney.
Sorry, and please fill out the surveys. We have about 75 responses so far. Our target is 300, so we would love, even though we wrote down your comments and feedback today, that numbers are powerful, so we're looking to, lobby and say we had this many residents fill out the feedback form as well. So if you can, please either scan the QR code, go to the website, or grab a paper survey from it.
Or if you have an event that's coming up, that might be a health fair or something going on, that we could be with you, in solidarity with you, we'll be glad to bring Sydney or bring a couple of us to explain.
Well, you want to train, because like there's 2 classes here, the yoga and the tai chi, and there's like 10 in one and 6 in the other. So you might not want to come for that small group, but if you wanted the teachers to do something like pitch the survey, I think they'd be glad
We'll come.
to. You want to come?
We'll come for 3.
Okay, all right.
Yeah.
So I'll let them know,
Yeah.
and they'll be in contact.
I saw Anita and I thought, oh, I need to join that class, so.
Yeah, there you go, good.
Okay,
I
wonderful.
have a question.
Yes.
What are the sites between these 3 zip codes? What are the sites that are problemsome right now?
As far as industry?
Yeah.
Um,
Unless there's others.
There are hundreds, everything
Yeah.
from dry cleaners to car repair where they, have to get rid of oils and things like that. There's actually a map that's on our website that shows all the industries that produce waste. And it's so tied into our lifestyle. So there's another whole thing we need to talk about, is our lifestyle and how we buy plastics, how we depend on all these chemicals, how we depend on all these products.
There was, the last I remember, and Mrs. Robinson was still our state rep at that time. She was borderline, her son was ready to come on. Was some site like in Detroit, like around 7 Mile and something? I can't remember too much more about it. I know I started to get active in it, and then everything because of COVID.
Yeah, U.S. Ecology, North and South have both been focused industries for us. We've also spent some time with the folks at GM, looking at the new Factory Zero and the things they're doing to be better neighbors in terms of pollutions. We are small, but we are mighty, but we could do a lot more with more people, but we have been focusing on U.S. Ecology.
Okay, so that's...
Yeah, and it's owned now by Republic Services.
Okay.
I don't want to keep you longer. Take some food and enjoy your afternoon. Have a great weekend. Thank you, Sydney. Thank you, everybody. Thanks to the library for hosting us. And we'll hang around if you want to ask us any more questions. Thank you. And please share this with other people. The plan and the feedback form, QR code, everything's right on the front page of our website and on our Facebook page. And our Instagram is @DHCoalition. Thank you.
If anybody wants to bring anything back to the senator, feel free to talk to me before you come.
That's fine. Okay, so I don't need to do that.
That's what we did.